watching Let's Chat.
We're glad to have you here with us as we continue on Let's Chat. And at some point, most of us are going to have some degree of knee pain. What happens when you get that? You go to the expert. In this case, we're going to Apple Physical Medicine and Rehab, Dr. Nick Circolone. Dr. Nick, good morning.
Good morning.
Knee pain. It hits people once you get to be a certain age, and some folks it hits before you get to be a certain age. Why is knee pain so prevalent among people, let's say, age 50 and up?
You know, we're an active society. So over the years, what has happened is we've just kind of wore out our knees. A lot of times, you know, knees are probably the third, I think, most common form of disability right now.
Wow.
Yeah, it's pretty big.
Well, you got to consider it's a complicated joint, and it is a load-bearing joint.
It takes a lot of pressure.
It's amazing that you see some folks who can go through their whole life with no knee pain whatsoever, and then you see some others that their knees literally have to be rebuilt. But hopefully that's where you step in long before the rebuilding process.
Yeah, hopefully we can get in there. You know, what we're doing in our office is we're doing what's known as viscosupplementation.
Tell me about that.
What that is it just hyaluronic acid. And what we do is we inject that into the area, and over time that helps rebuild the cartilage in there and helps decrease the pain in a lot of the patients. What's different in our office is we actually do it under fluoroscopy. We actually visualize it under an x-ray type of machine to see where it's going to go. Whether it be a knee that has fibrous tissue in there, there's bony abnormalities that are in there. We know exactly where we're going, so that gets a better benefit of it.
And you said it helps rebuild the cartilage in there, and that lack of cartilage is the direct key support thing as far as knees are concerned.
Right. When you lose that cartilage, that's when you get that bone on bone and you get that pain that most people get.
And it will debilitate you, and many of you know what I am talking about. Now, what's the rate of success on this, for lack of a better term?
Well, you know, the way we do it, which is a little, like I said, a little bit differently, we use a brace that helps decompress the knee as well as doing the injections. So not only are we injecting a medication in there to help regenerate that cartilage, but we're also taking a brace and decompressing it so that it has a better chance of doing it. So basically, I would say probably 80% to 85% of our patients get pretty much full relief out of it.
Pretty good, pretty good odds on that one. Now, let me ask you this: how long before? And I know there's no such thing as a typical average knee, but how long until a patient in pretty good health can expect to see a difference?
Well, you know, sometimes people see it right after the first injection.
Wow.
And what's nice about the medications that we use, in 6 months we can do it again. So we're not only, it's a process where we can keep building on that. So in 6 months we do it again. So we're building on it slowly but surely.
And I know that you work on a whole lot more than just knees.
Oh yeah. Yeah, there's now hyaluronic acid hasn't been used for hips, hasn't been used for shoulders, but they're starting to use that more and more and being reimbursed by insurance. Right now, the insurance is reimbursing for knees, but
And
the other
that's
joints,
good.
oh yeah, but the other joints, it's, you know, they're still working on it.
You know, and having been through a hip replacement and having good friends who have gone through knee replacements, they swear up and down that knees are a whole lot worse than hips or just about any other joint as far as pain and recovery time. And you guys at Apple Physical Medicine and Rehab, great to alleviate that.
Yeah, there's so many ways to get rid of that pain, you know, but this is just one of them.
Just one of them. If you want to find out more, check out Dr. Nick Circolone and the great folks at Apple Physical Medicine and Rehab. You can find them at 7400 block of Shallowford Road, Suite 108. Call them, 855-7376. The number again, 855-7376. And the website, applerehabgroup.com.